Hi, I'm Dr. Suvarchala, Scientific Director at Ziva Fertility Centers. Today I'd like to talk a little about the male reproductive system and what causes male infertility. The second part is more interesting, what causes infertility. But unless you understand what the anatomy is, you won't understand the science behind it, the mechanism behind it, and what is it that causing infertility, especially if you're dealing with it. The male reproductive system, as you know and as you can see in this picture, hangs outside the body. There is a reason for it. The temperature of a human body is 37 degrees and 37 degrees is too hot for the sperms to survive. So sperm production, survival, the ejaculation, everything should happen at a temperature which is lower than the body temperature, which is why the whole reproductive system is outside the body. Isn't that interesting? Because 35 degrees is what is required for the sperms to be produced and to be able to survive. So the entire testis, the penis, everything is outside, but the other parts of the bodies like seminal vesicles and prostate that give a lot of nutrients, as to say, to the semen are still inside the body. So if you look at it, the testis is outside, and that's where the sperms are produced. Once they are produced, they are transported into tubes that are taken inside the body, and again they are ejaculated through the penis. Now if you look at the tube, it's quite a long distance for the sperms to travel, and you will be amazed at this amazing mechanism, because about 3,500 sperms are produced every second of a male at a reproductive age. So it's a very interesting phenomenon. But although I say that they are being produced, they are not being released. By the time they gain the capacity to swim, which is motility, they are able to have the capacity to fertilize, it takes about 72 days. So for them to be produced in the testis and to travel and to be ejaculated, it takes them about 72 days. So that's a very interesting part of the single celled beautiful mechanism of the human body. Now the causes could be many. Once you understand the mechanism, there could be a blockage somewhere, there could be some part that is missing. Let's go through them one by one. So if there is a blockage somewhere in the the tubes that are present, because as I said, it's a very long tube, a long journey, then the sperms are not ejaculated outside. They could be produced, but they could not be, maybe that's the reason they're not being ejaculated, and that's the reason for azoospermia. Now azoospermia is no presence of sperms. So that's one of the causes. And like I said, maybe a part is missing. So maybe a part of the tube is missing, and that's a genetic factor, called cystic fibrosis. So there is a genetic problem in the male, and because of which a very important part, the vast difference, it is a tube which is not present in these cases where there is a cystic fibrosis gene which is playing a role, and that's the reason they are having no sperms in the ejaculate. So what I'm trying to say is that sperms are being produced, but they're not being ejaculated. So that's another reason for infertility. One of the main reasons for infertility could also be varicocele. Now you must have heard varicocele in various parts of the body, especially legs, for people who stand for too long especially. Varicocele is also observed in the testis. Now what is varicocele? It's basically the the blood supply which is there to the testis is engorged, so it becomes very hot over there. The temperature rises maybe 37 or more than 37, which is not good for the sperms. Like I said, it should be 35 degrees. Now at 37, sperms either are very low in count at that high temperature or are totally not present. So it depends on the grade of varicocele. Is it too severe, or is it moderate, or is it just very little? Depending on that, the count in that male also varies. Also, this varicocele can be rectified with a simple surgery, again depending on the severity of the varicocele problem. So this is a very common cause to be seen in male. In addition to all this, we also have reasons associated with the lifestyle changes. If you have diabetes, if you are overweight, if you are using steroids, especially muscle building steroids, especially bodybuilders use that. So if you're using all that, that could also affect sperm production, which is why we see low count in these cases. Associated with that is also a very high testosterone level in that in that person. That's because they're using a lot of testosterone and so that's bringing down the production of sperms, which is called as spermatogenesis. So that's basically one of the reasons for male infertility. In lifestyle changes, we also have to definitely talk about the choices that you make in life to improve your health. Suppose you smoke, you need to stop smoking because nicotine has a detrimental effect on spermatogenesis, which means that your sperms are going to be affected. It doesn't mean that you will be azoospermic, as in your sperms will not be present, but it definitely means that it could cause internal damage to the sperm, which I will tell you in a short while. So smoking, alcohol, definitely your like I said, your weight, your sedentary lifestyle, if you're going through all that, you need to stop all this, and also bring in good dietary habits, because not just supplements, food is a very important source of antioxidants which will enrich this whole process of spermatogenesis. Now if you were to look at what changes smoking and all these other changes that I was talking about cause, it causes DNA damage in sperm. So the head of the sperm carries all the DNA that comes from your father. So each sperm is capable of fertilizing an egg and bringing about an entirely new individual. So it's a very unique process, and this DNA, it is packaged very well inside that tiny head. If there is any damage to that DNA, the embryo which is formed could be poor quality, it could not progress. Even if it does, and it does implant inside the uterus, it may miscarry or it may have complications later as an offspring. So there are many causes and many effects of this DNA damage. We now do a test called DNA fragmentation test, with which we can assess whether there is a problem in the sperm's DNA. So this is a very good method to find out if there are changes in lifestyle which are causing this DNA fragmentation, or age which is contributing to this DNA fragmentation. So another very important factor that we check when we want to look at what is causing the male infertility. Now while I say these are the causes, how do we get to know? Are there any symptoms of male infertility? You have to understand that a male does not present with any symptoms when he is suffering from male infertility. When that's the cause of male infertility, he does not present with a symptom unless he has erectile dysfunction problems, unless he has ejaculatory problems. There will be no symptoms of azoospermia when sperms are not present, or there will be no symptoms of sperms being poor in quality. So that's a very important factor. If you are unable to achieve pregnancy in 1 year of trying, and your wife is 30 years or younger, and you've been trying for 1 year with the unprotected sex, you're not able to conceive, then that's the time you need to go for a thorough examination. We will talk more about what I have just said, the investigations that are involved. Please feel free to leave a comment or call the number that you see on the screen to understand more about male infertility. Thank you.